Good afternoon.
Good afternoon.
So this is a recorded session for the OET speaking subtest, which is held at Teachers Academy, dated 24 January 2025. Well, my name is Varsha and I'm the interlocutor for your speaking subtest. How are you?
I'm fine, thank you.
Okay. So the candidate name is Anju Susanna Thomas and the candidate number is 215304. Is it correct?
Yes.
Okay. So I guess you're taking this test as a nurse. Am I right?
Yes.
All right. Well, Anju, we're proceeding with the warm-up session. Before that, I would like to verify your ID. Can I?
Sure. Here it is.
Okay, thank you for that. So let's proceed with the warm-up session.
Sure.
So this session will be recorded, but it won't be assessed. So it is just to get familiarized with each other's voices. So can I proceed?
Sure.
Okay. Could you please introduce yourself?
Thank you. My name is Anju Susanna Thomas. I'm from Alappuzha. I've completed my BSc Nursing from Rajiv Gandhi Institute of Medical Science in the year 2000. And I have 2 years of experience in OT.
All right. Well, Anju, as you told me that you're a nurse, so if you have been given a chance to change one thing in your profession, what would you like to change?
Well, thank you for asking me this wonderful question. If I'm getting a chance to change something about my profession, I'll definitely change the attitude towards nurses because I believe that nursing is a wonderful profession which requires a lot of dignity and respect. So I think that nurses deserve a lot of respect. So if I'm given a chance to change something about my profession, that will definitely be the attitude towards nursing.
So I have another question for you. Could you please tell me about your hometown?
Well, my hometown is Alappuzha. It is known as the Venice of East and it is famous for its scenic beauty and the famous portraits.
All right. Well, Anju, do you think this continuous nursing education is important for the nurses?
Well, I really think that continuous nursing education is very much important because nursing is a dynamic profession where change is happening on a daily basis. So I really think that continuous nursing education is very much important.
All right. So Anju, that's the end of our warm-up session. Now we are proceeding with the role play card presentation. So this is your very first role play card and you'll be given 3 minutes time for your preparation. You may start.
Thank you. How may I address you during the role play?
So you can call the patient Jenny. All right, Anju, your time is up and you'll be given 5 minutes for the presentation. You may start.
Thank you for allowing me to examine you, Jenny. In order to get a clear picture of your condition, may I ask you some questions?
Sure.
So when did it started?
Well, nurse, I noticed this thing. It's been 2 weeks as of now.
Okay, did you notice any pain or any kind of itchiness?
No, nurse, I don't have any such symptoms.
Was there any previous occurrence?
No, this is the very first time.
Are you allergic to something?
No, nurse, I don't have any allergies.
Thank you for your information, Jenny. Your informations are noted. So, do you have any idea regarding the condition called warts?
No, nurse, I'm hearing this term for the very first time. Could you please tell me what exactly it is?
Don't worry, I'm here to explain you what it is. So, based on the examination and from the information that you have given me, I suspect that you might be having a condition known as warts. So, it is actually a small fleshy bump on the skin or mucous membrane which is commonly caused by human papillomavirus. Am I clear to you?
Yeah, I got an understanding.
Okay, do you have any concerns?
So, just like I told you, I'm hearing this term for the very first time. I would like to know about the causes.
Okay, that's a very valid concern from your side. I can explain you regarding the causes. Just like I've mentioned earlier, this condition is caused by human papillomavirus and stress and direct contact with infected person can also be a reason for this condition. Sometimes vitamin B deficiency can also be a reason for this. Am I making myself clear to you?
Yeah, I got a clear clarity.
Okay. Do you have any other concerns?
Well, to mention, nurse, I'm quite anxious about my current situation. I'm really worried about the seriousness of this condition, especially its spreading.
Okay, don't worry, Jenny. I know it is an overwhelming situation for you. If I were in your position, I would have reacted in the same way. There are many ways to avoid the spreading of warts. First of all, you need to avoid direct contact with the infected person and maintain a personal hygiene and use separate personal belongings such as soap, towel, etc. Will you be able to do that?
Sure, nurse, I'll follow your instruction.
Okay. Is there anything else bothering you?
Well, I just need to inquire about the treatment options. So could you please help me with that?
Well, definitely I will explain about the treatment options to you. Applying salicylic acid will definitely help to reduce the swelling and redness. And there is a therapy known as cryotherapy which will remove the abdominal tissues. And then there is laser treatment which will reduce the wrinkles, scar and skin tightness, and it will remove the lesion. Is that clear to you?
Yes, I got an understanding.
And regarding the medication, vitamin B12 supplements as well as zinc supplements are also available, and the doctor might recommend you with anti-inflammatory and over-the-counter cream. Is that okay to you?
Sure, nurse.
Okay. Is there anything else that I need to clarify?
So I have one more question. I'm really worried about the prognosis of this condition, and also could you please help me with the recovery time?
Don't worry, Jenny. I can put myself in your shoes. I can really understand what you're going through. I can explain you what it is. Normally, it disappears on their own, although it may take months or years. But whereas some warts need treatment. Is that clear to you?
Yeah, I got an understanding, nurse.
So is there anything else that I need to clarify?
No, I can say that you've clarified everything for me and I got a clear idea about what this condition is. Thanks to you, nurse.
Okay, if you want, I can make an appointment with a dermatologist. Would you like to?
Yeah, sure.
So I'll make the arrangements for the appointment. Meanwhile, let me brief what we have just discussed. So warts is a small fleshy bump on the skin or on the mucous membrane which is caused by human papillomavirus. The causes are stress, direct contact with the infected person, or sometimes
Yes, Anju, your time is up.
Thank you. Thank you for your patient listening.
So we're proceeding with the next role play card. So you may just turn the page.
Thank you.
So this is your second role play. Again, you'll be given 3 minutes time for your preparation and your time starts now.
Thank you. So how may I address the patient during the role play?
Alright, so you can call the patient Aiden.
Thank you.
Yes, Anju, your time is up. So you can present for your 5 minutes.
Good morning.
Good morning.
I am Anju, one of the registered nurses working in this neonatal intensive care unit. Am I speaking to Aiden's parent?
Yes.
For my better communication purpose, could you please tell me your name?
You can call me Peter.
Okay, Peter. So I know it is an overwhelming situation for you, Peter, but please keep your mind at ease. I'm here to explain regarding your child's condition. May I?
Sure.
Okay. Your child is having a condition known as cleft lip and palate. Have you ever heard about this?
No, nurse.
Well, this is the opening or splits in the upper lip or the root of the mouth or both. Am I clear to you?
Yeah, I got some sort of an understanding.
Okay. Do I need to clarify anything?
Yes. Well, nurse, I really don't understand how my child got this thing. So could you please help me with the causes?
Well, I really understand what you're going through, Peter. I know it is an overwhelming situation for you, but please keep your mind at ease. I can really explain to you what are the causes of this condition. Well, genetic deformity, smoking, drinking during pregnancy, obesity, and sometimes diabetes, lack of folic acid, and certain medication including anti-seizure and steroid tablets can be a cause of this condition. Am I clear to you?
Yeah.
Did you notice the relevance of these in your case?
Well, I can see that my wife was on anti-seizure medications. Other than that, she had this pregnancy-induced diabetes.
So that could be the reason for your child's condition. Don't worry, we are here to help you. So is there anything else that I need to clarify?
Well, nurse, I just want to know how this condition can be managed.
Well, that is a very reasonable concern from your side, Peter. I can explain you regarding the care plan as well as the treatment. There are different type of care plans according to the age. I will explain to you one by one, don't worry. So from birth to 6 weeks, there will be feeding assistance, support for parents as well as hearing test and pediatrician assessment will be given. And from the age of 3 to 12, surgery and repair will be done. And from 18 months to 5 years, speech assessment will be given. From 8 to 12 year, bone graft to repair a cleft in the gum area will be done. Is that clear to you?
Yeah, I got an understanding now.
Okay, now I will explain regarding the treatment options. Lip repair surgery as well as palate repair surgery can be done in this condition. Am I clear to you?
Yeah, I got an understanding.
Is there anything else bothering you?
Well, I just need to make an inquiry about the challenges that my child might face in the future.
Okay, Peter, I know you are going through a very tough situation, but please keep your mind at ease. In my experience of 2 years, I have dealt with many patients. I can assure you that we can provide you with proper assistance. Now, I'll explain to you regarding the challenges your child might face. Your child might face challenges such as feeding difficulty, ear infection, hearing loss, dental problems, and speech difficulties. Am I clear to you?
Yeah, I got an understanding.
Okay, is there anything else that I need to clarify?
So, this is my very first kid. I just want to prevent such complications in my future babies. So, what can be done for that?
Well, that is a very sensible question from your side, Peter. I can explain that to you. Consider genetic counseling before getting pregnant, as well as take prenatal vitamins. And it is very much imperative to avoid alcohol and tobacco consumption. Is that possible?
Yeah, sure, nurse. We'll keep all these things in mind.
Okay. Is there anything else that I need to clarify?
No, I can say that everything is clear now. Thanks to you, you have provided me adequate information.
Okay, Peter, I know that you are going through a very tough situation and I clearly understand that it is an overwhelming situation for you. But please don't worry, you are not alone. We all are here to provide you with guidance and assistance. Do you have any other concerns?
No, nurse.
Okay, so I hope I have clarified all your doubts. If you have any other concern, please feel free to contact me. I am here to help you. Thank you.
Alright, your time is up, Anju. Thank you for the presentation.
Thank you.